Magellan of Idaho, not BPA Health, now anchors the state's DBH-funded SUD network, and that changes how you turn a group practice into an IOP or PHP in Idaho. Older Idaho materials still reference BPA Health. The current DHW provider language points to Magellan of Idaho, and a converting practice should never build on stale network assumptions. The conversion decision is not simply whether demand exists. It is which lane you are entering, and what must be verified before you rebrand. We will walk the licensing questions, the staffing and leadership gaps, the location test, and the Idaho payer map before you market the program. Idaho's planning question is about lanes, not demand. Is your group practice staying in a private pay or ordinary professional practice lane? Or is it moving into DBH-funded substance use disorder treatment, Idaho behavioral health plan workflows, Magellan network participation, and Medicaid managed care rules? Before building on demand, use findtreatment.gov to compare your market against existing providers in Boise, Meridian, Nampa, Idaho Falls, Coeur d'Alene, Twin Falls, and the rural regions you serve. Search phrases like Idaho IOP licensing requirements may not match the state's exact categories. Treat them as discovery terms, not answers. Build the operating model around a stale network or the wrong service definition, and the program you market may not match the pathway Idaho actually requires. Verify the correct pathway with DHW, Magellan, payers, and qualified counsel before advertising or billing, not after. Conversion makes group schedules, documentation, payer reviews, and discharge planning far more visible. Behave Health is designed to support that operational side. Behave Health's behavioral health EHR, CRM, and RCM tools are designed to support group documentation, authorizations, and claims work as the program scales up. And Behave Consulting helps group practices evaluate licensing readiness, payer workflows, admissions operations, and documentation design. The clinical and regulatory model still needs Idaho-specific review with the state, payers, and council. Here are the 4 checks to resolve before you market an Idaho IOP or PHP. Licensing pathway, staffing, location, and payers. Check 1. Resolve the licensing pathway. Idaho DHW's Behavioral Health Service Providers page describes DBH standards and the SUD services program, which contracts with Magellan of Idaho for statewide treatment and recovery support. IDAPA 160717 is the administrative rule source for behavioral health services. Treat it as a verification point for your specific service model, not a generic checklist. Decide whether your IOP or PHP is private pay, Medicaid-facing, DBH-funded, non-Medicaid IBHP, or a combination. Then verify that pathway before billing. Check 2. Fill the staffing and clinical leadership gaps. Who owns program-level clinical governance, and who keeps group documentation, authorizations, and claims aligned? Who handles rural access when a client cannot travel several days per week, and who monitors whether Magellan or public funding requirements change? If those answers are unclear, that is a signal to pause before launch. Check 3. Decide whether your current office can support the level of care. An IOP or PHP may need predictable group rooms, private intake and documentation workflows, family contact capacity, and medication or lab coordination depending on the model. If you serve clients outside a metro area, plan for drive times, weather, referral geography, and a realistic transportation or telehealth option. Verify the exact expectations with the agency, payer, local authority, and council for your proposed address and service model. Check 4. Map the payers before you rely on the revenue model. Verify provider enrollment, facility or program credentialing, medical necessity criteria, documentation expectations, and authorization review with each payer. A practice that has billed ordinary outpatient therapy may not yet have the enrollment, authorization, and claims workflows that structured IOP or PHP services demand. Your Idaho payer map should cover Medicaid and non-Medicaid IBHP workflows, Magellan participation, commercial credentialing, and whether your documentation supports the level of care being billed. One reference point to keep straight: the Idaho Behavioral Health Plan. DHW says the IBHP offers outpatient, inpatient, residential, and crisis behavioral health services. It serves Idaho Medicaid members and other eligible members without Medicaid. And adults who gain Medicaid through expansion are eligible for behavioral health services through the plan. The plan is managed by Magellan Healthcare, which also manages the provider network. Stop building your Idaho IOP or PHP on stale network assumptions. Scope the conversion with Behave Consulting. Book a 20-minute demo at behavehealth.com. Talk with Behave Health before you market the service or commit capital. Book a demo at behavehealth.com.